Women just don't talk about this stuff. And I don't know why that is.
There's actually kind of a sisterhood of silence around pelvic floor disorders. So many women put up with it for years. But Nicole is definitely vocal. And honestly, we need more of that to just raise people's awareness.
As I was going to the restroom, I noticed something didn't feel right. I had something the size of an apricot hanging out of me. I'm like, oh my God, what is going on? So I got in to see the nurse practitioner, and she validated that I had a prolapse bladder and a partial prolapse rectum. I'm like, what? They told me that they need to refer me to a urogynecologist. So I finally got a referral to UCSF.
Our Urogyne department here at UCSF is being reborn. We take care of women who have pelvic floor disorders. We want women to come to a place where they're being seen by people who are doing the state of the art, who are advancing the field.
Hi, how are you?
And also have that connection to the other subspecialties that are here.
2 mLs of fluorescein, please.
Dr. Ram, who is our fearless leader, is one of the best, if not the best surgeons I've ever operated with.
The pelvic floor is made of muscles that create a shelf for all of your organs to sit on from the diaphragm on down. And when there's been structural damage or nerve damage to those muscles, then they can separate and sag, and there's a lack of support for these organs, causing this protrusion of tissue. Pelvic floor disorders can happen for a variety of reasons.
So nice to meet you.
There are genetic factors, environmental factors, menopause. And then the big inciting factor for the majority of women is pregnancy and delivery.
I didn't know at that time a vaginal birth could do something like that. And my hysterectomy as well, too.
That looks like it's
The median duration of the second stage of labor for a first-time mom is somewhere around, 100 minutes. And there are women pushing out there for 3, 4, 4.5 hours. The longer that a woman spends pushing, the deeper the extent of that neuromuscular injury.
And that's why it's important to have good quality information about the risks and benefits of how to deliver your baby, and to give women that choice, the education, and the autonomy.
So my husband and I went to go see Dr. Ram. Sure enough, she gets in there, she examines me, and she says, yep. So here's your options.
One of the things that I think really sets our program apart is the breadth of options that we're able to offer to patients, vaginal, laparoscopic, robotic.
But we offer just as many non-surgical treatments, like pelvic floor physical therapy, pessary, which is like a brace, as well as medications and lifestyle modifications.
Aligning people's goals with the treatments that we offer and vice versa is really what makes us unique.
I think she took like a solid 45 minutes with us.
Nicole really felt quite certain that surgical treatment was the choice for her, and we found surgical time for her.
I remember being really nervous, and they were getting ready to put the mask over my face, and I started to panic. And who do I see? Dr. Ram comes right down to me. She grabbed my hand, and she's like, I need you to breathe. You're gonna be okay. And then I woke up. Dr. Ram was there, and again, she was just touching my hand, and I was loopy, but I saw her again, and those wonderful, kind eyes.
The mesh gets placed like this.
I basically got a nip and a tuck. You put the organs in the lattice, and then it starts growing all its vessels, and it starts adhering to that lattice and staying lifted. Should we go for a walk? Now I'm back to my full workout routine. I have nothing but the utmost confidence that everything's okay with me.
Part of our mission is to educate women even before pregnancy and especially before delivery that these conditions exist, and there are things we can do proactively to diminish our risk of them. Oftentimes, they are like this constant pebble in a person's shoe that makes them not show up as their best, most vibrant, authentic self. So if we can somehow make it better, take that pebble out, then think about how much more they can give to the world.